I'm Giulia Baciarello. I'm a medical oncologist at Gustave Roussy, Villejuif, France. ARAMIS trial was a very important study in which non-metastatic castration-resistant prostate cancer patients were randomized to receive darolutamide or placebo while continuing ADT. A total of 1,500 patients were randomized in a 2-to-1 ratio to receive darolutamide or placebo. We already seen the results in terms of metastasis-free survival. The darolutamide showed an improvement of about 2 years in metastasis-free survival. Darolutamide also improved time to pain progression and time to skeletal-related events in compared to placebo. Well, the results presented yesterday by Karim Fizazi showed that darolutamide is also extremely safe. That means that toxicity events are not increased in patients treated with darolutamide compared to placebo, and especially toxicity like fatigue or cognitive impairment or also cardiovascular events. Quality of life was studied with the BPI inventory test and ERTC-QLQ, FACT-P questionnaire and EQ-D53L questionnaires. So we've seen that treating a patient with darolutamide do not cause a deterioration in quality of life, and especially patients treated with darolutamide have an improvement in time to deterioration of about 3 months. Of note, treatment with darolutamide also delayed the time to deterioration of bowel and urinary symptoms. So to conclude, we already know that darolutamide is superior compared to placebo in improving metastasis-free survival, but now we also know that it's a safe treatment and that darolutamide does not increase toxicity compared to placebo. There's not have been a head-to-head comparison, so we cannot compare one drug to another. What we can see is the toxicity events in the different trials. And what we see, for example, is that we have 30% of patients who experience fatigue with apalutamide and enzalutamide, and while we don't have an increase in fatigue in patients treated with darolutamide compared to placebo. So we know that darolutamide probably doesn't pass the blood-brain barrier, and that is probably why we have a less incidence of fatigue and cognitive impairment, and that is probably why it will be more tolerated. But again, we don't have a head-to-head comparison, so for now we can't see it. We will have an head-to-head comparison in a patient preference trial named ODENZA, which is ongoing. The ODENZA trial, well, we will expect that probably darolutamide will be better tolerated and so preferred by patients over enzalutamide.